Now we're going to jump to the next section, and Victoria will be my co-moderator. Welcome, Victoria.
Can I?
Yes, go ahead.
Okay, so I will start in Ukrainian a little, okay? Шановні колеги, доброго дня. Дозвольте вітати вас на засіданні секції, останньої, але не менш цікавої, яка стосується, власне, медичної освіти. І медична освіта зараз в умовах ковіду, війни, побудова якісної медичної освіти, максимально наближеної до реальних умов, в умовах кадрового дефіциту, який наростає в нас в Україні, є, звичайно, високо актуальним питанням і дуже важливим для мене. Тому, вперше за все, дозвольте подякувати професору Заячківській за запрошення бути одним з модераторів даної секції. So, with my great pleasure, I would like to open the section that is addressed to the medical education, and thanks to all participants for their interest in this section. And we hope for the successful section and fruitful discussion at the end of the session. So let me introduce my co-chair, professor, a big friend for Ukraine, from the cardiosurgeon from the Chicago University, and invite him for the first presentation. Please, Professor Vassyl Lonchyna, can you start the first presentation?
Okay. So we're going to begin the session on medical education, and I've got a few speakers lined up to follow me that have to do with various aspects of medical education in Ukraine. I'm going to start by kind of laying the groundwork for the interpretation of what medical education is like in Ukraine based on my year as a Fulbright Scholar a number of years ago. I had the opportunity to visit a number of medical universities. I sat in on their lectures, spoke with professors, lecturers, spoke with students, and observed them in action and looked at their universities and came upon a number of conclusions, which I will let you know. But the first thing I want to talk about is, you know, a very interesting quote came from the Assistant Minister of Health in those years, 2016 to 2018. Remember, Iryna Stelmakh was the Minister of Health, and her assistant or deputy minister was Oris Linchevsky. He is a thoracic surgeon and a very outspoken type of person, very interesting, salt of the earth type of person who speaks his mind. And he says, you know, how do you find a good doctor in Ukraine? There are two questions you should be asking. And one is, do you have faith in your doctor? And the other is, does your doctor speak English? You know, on the basis of these two questions, you can come to the conclusion if you've got a good physician that's taking care of you. And why do we say that? And why should we talk about reforming medical education in Ukraine? Well, the top 10 diseases in Europe are the same top 10 diseases in Ukraine. There's no change. I mean, it's the same kind of population, European population, and they suffer the same kind of illnesses. There's no magic about the geography that causes them to have different health issues. However, the top 10 treatments in Europe are not the same as the top 10 treatments in Ukraine. And who's right? I mean, the Ukrainian therapy, the Ukrainian farm is different. It's so different, and it is because of the fact that they grew up in the Soviet bloc. They were isolated. Of course, Western medicine was not good, and you know, some of that still prevails. Even now, if you talk to an older physician, they will tell you something like, why should I use the guidelines of the Western medical world? I mean, our medicine is the best in the world. I mean, you still hear that today. So here's what I've got a whole bunch of points, bullet points to talk about my observations of medical education in Ukraine. First of all, the course lasts for 6 years. It's similar to European schools. Nothing wrong with that. 6 years of study, which is kind of a combination of undergraduate and graduate medical education. Students matriculate at medical schools at the age of 16 or 17 years. That's pretty young, you know, when you're not all that developed mentally and psychologically to make a decision that you're going to be a doctor. and to undertake a serious study of medicine. There's an extremely low average national scores for admissions, 103. Now, to give you an idea of what that means, the top score is 200. And the minimal admission for law schools in Ukraine is, I think, around 140, 145. The matriculating freshman class at the Ukrainian Catholic University in Lviv has an average score of 181. So you take a look at that. I mean, you want a philosophy major to be smarter than a doctor that's taking care of you, 10 years down the line. Students are not able to switch majors once enrolled. And barely 50% of the graduates really practice medicine after graduation. They do other things. Some may be paramedical, they may be, selling drugs, for a pharmacy company, but most of them are totally different professions when they finish medical school. The lecturing system is antiquarian. You walk into an old auditorium, and there's nothing wrong with old auditoriums. So you walk in, the students are dressed in white coats and have these white hats. They stand as a professor walks in, they sit down, and they're to be quiet. There's no commotion. There's no raising your hand to ask a question. And the professors read lectures, читает лекции. I never could understand what does it mean when they читает лекции. I mean, to me, it sounded kind of strange to be doing that. And, I found out because, many professors will get up there and they will read their chapter in a book that they wrote. Of course, there are some good lecturers. There are others that know how to lecture. They're very good. They'll get up there, have their slides with bullet points, and they will talk about, what the subject is. But there are others that actually read a chapter out of their book. There's minimal to no interaction with students. During a lecture, you don't interrupt the professor. You don't ask questions. You don't go up to him at the end of the lecture and ask him to please explain this to me again. Old professors do not relinquish their positions to the younger faculty. They hold on. They die in the schools. They never retire, and they hold on to positions of administration. I mean, one of the deans of the medical school is 82 years old, and he was reelected for another 10-year term. Well, progress will never be made in such an institution. There's no free access of the students to the professors. There's no open door policy. They can't go to the office or ask them for a cup of coffee and talk about anything that's on their mind or about the subject matter that they're being taught. The interruptions are not allowed during lectures. And the reason for that, the professors say, well, I don't want them to interrupt my train of thought. Well, the train of thought can't be interrupted when they're reading their lectures, can it? So the medical curriculum is centrally controlled in KU by the Ministry of Education, Ministry of Medicine. The local universities do not have the academic freedom to figure out what they want to teach. I mean, every school in the United States has their own curriculum, and every 5 years they'll change it or they'll expound on it. So, we have freedom, academic freedom here, that we can do what we want, what our faculty think is best for the students. Here, it's a centralized Soviet style curriculum. The departments show very little initiative or innovations. Textbooks are written locally by professors without a worldview, but it's the way the Soviet style. We know best, and we're not going to look into the international literature to see if there's anything else out there. Educational materials are relics of the Soviet era. Laboratories are antiquarian. They're just in poor shape. And libraries are not up to date. There's minimal no English language references, and if there are anything, it's a book from 50 years ago or so. English language is not a requirement for students, and only a small percentage of faculty have proficiency in the English language. Interesting, there's a separate curriculum, faculty, and lectures for foreign students. So this harkens back to the proprietary schools in America, over 100 years ago. It's a business. Foreign students are a business in Ukraine. They're not there to train physicians. They're there, because they get $3,000 or $5,000 per student per country from India, Bangladesh, or Africa, or wherever. It's a good business to run. I asked some of these students, well, if you don't know the language, how do you talk to patients? And they say, well, we just wait for the summer. We go to our country, and then we go to the clinics in our country, and we take care of patients. That's how we learn clinical medicine. Clinical departments are separate for medical students and for postgraduate training. So, in the States, you have a department of surgery. And in that department, you will have medical students rotating, you'll have interns, residents, you'll have faculty, and so it's all uniform. Here, there's a department in the medical school, there's a department in each hospital, and they don't communicate with each other. So yeah, students do go elsewhere, but then they have a different set of people taking care of them that are not, that do not belong to the same faculty or to the same structure. Internship, which can be up to 3 years, there's no choice where you go in the location or even the specialty. You're sort of assigned, especially if you're on a government scholarship, you're government funded. The internship is non-structured. Learning is passive and private. So, unless you're with an excellent physician, you're not going to learn much. The residency is a form of apprenticeship. You're there forever and ever and ever, similar, I guess, to the English system. And there's unwillingness of professors, especially surgeons, to pass on their knowledge to students. I mean, they are in fear of training to competition. I mean, they are the professor, they do even the younger staff members in the Department of Surgery defer to the professor to do the operation. So it's a really hierarchical hierarchy of people here. So what can we compare this with? Benjamin Franklin, many years ago, said, if you want to advance human knowledge, you need more than just an assortment of brilliant individuals. You need funding, you need schools, associations, and learned societies. And you need libraries and periodicals, and you need apparatuses, the people who know how to make it and the facilities in which to put it. And you need a culture of free inquiry, teamwork, mutual respect, and civility. This is really the groundwork for education. And this is something that really we need to foster. Over 100 years ago in the United States, the US, I think, had similar medical education structure as Ukraine has now. In the Flexner report, the Flexner report was commissioned by the American Medical Association, by the Carnegie Foundation. So in 1908, Flexner, who was an education specialist, visited all 155 medical schools that were then present in the United States. He's known for pioneering the concept that education should be marked by small classes, personal attention, and hands-on teaching. And what he examined at each medical school were the entrance requirements, the size and training of the faculty, the size of endowment and tuition, the quality of laboratories, the availability of a teaching hospital whose physicians and surgeons would serve as clinical teachers. So his report, it says that, each day students are subjected to interminable lectures and recitations, so long mornings of sections and a whole bunch of lectures, et cetera, et cetera. And in the evening, they continue with their reading and preparations. If fortunate enough to gain entrance to a hospital, they observed more than they participated. They observed more than they participated. And this is similar to what I observed with medical students on the clinical wards. I mean, I was shocked when, just serendipitously, while I was touring an intensive care unit, there were some medical students there. And there was a patient who needed an NG tube. And I mean, they just stood around, they didn't know what to do. And course, I didn't put it in, but I taught them. I told them, you know, if you take an NG tube, this is how you insert it. And this is what it looks like. And I said, hold this and et cetera. They had never been approached in that manner. And I mean, no one went up to them to teach them a simple thing like an NG tube, you know, what it looks like, you know, how it's inserted, why it's inserted, what's its purpose, et cetera. And this is what happens throughout. You know, they follow the surgeon around, but they don't scrub in surgery. They don't really do much. They just observe. So, you know, how can you learn much? And Flexner concluded by saying, if the sick are to reap the full benefits of recent progress in medicine, a more uniformly arduous and expensive medical education is demanded. And that's what they did in the United States. There was a great reform of medical schools, and that's why we have, you know, such great institutions now, you know, 100 years later, 120 years later. This is what Ukraine needs. They need a Flexner and a Flexner report to shake up the system. So just a few thoughts on reform of medical education, you know, selection of qualified students, up-to-date facilities, equipment, academic freedom, curriculum development, responsible teaching, English language instruction references, internet-based learning, and clinical medical ethics in the curriculum. So really, they should select highly qualified. I mean, you know, the bar's got to be, you know, much higher than it is now. There should be some competition for entrance, so you get the best and the brightest students in medicine. Ulyana Suprun, when she was Minister of Health, inserted questions from the United States medical examinations, just, you know, maybe 30 or so, into the yearly exam that the students take. And, you know, here's a list of all the medical schools who participated, and you can see that, you know, at the you know, how many students passed the exam. At max about 5%, but, you know, but you can take a look at that column. You know, is pitiful that they were not able to answer questions that every medical student in the United States is trained and taught to answer. So infrastructure, you need good laboratories, you need good libraries, you need lounges. The Sheptytsky Center in Bihun, the Ukrainian Catholic University, is an example. This is not a medical school, but it's an example of how important a library is. I mean, this is a brand new modern library that has a lot of books that are modern, up to date, current. The environment is conducive to learning. People want to come here, they aggregate here, and this provides for an environment for learning. There has to be academic freedom. You need to be able to search for truth and knowledge and to impart these truths to others. The curriculum should be international knowledge. There should be an emphasis on active learning and integration among disciplines when it's possible, and a requirement for some sort of scholarly project for all medical students. English language should be utilized as the instructive language, at least for some of the courses, but certainly for the references. And why? I mean, we heard earlier, Agnes Henry said that that an article in English will have a wider audience. And yeah, English is a lingua franca, as you can see in this graph. You know, German and French, hardly anyone uses that as an international language in medicine. If you look at journals, you know, what countries still publish in their language? Russia. 90% of their publications are in Russian, whereas Switzerland and Austria and Germany, 75% or more, and even Japan are in English. Because if you want to have a wide audience, you've got to publish in English, and you've got to read in English, and you've got to read the world literature in English. So language learning has to be based on internet, both for distance learning and also for computer assisted instruction. And, we should introduce ethics into the curriculum and also into everyday practice. And there are such topics as physician-patient relationship, informed consent, et cetera, et cetera. Education and ethics will lead to a compassionate physician, which is really what we need in our graduates of medical schools. We need to produce compassionate physicians. And how shall we go about changing medical education? It's got to be a big plan. And Daniel Burnham, who's laid out the plan of Chicago, which resulted in what a great city Chicago is, especially the lakefront, says, make no little plans. They have no magic to stir men's blood and probably themselves will not be realized. Make big plans, aim high and hope and work. And I'll leave at that. And we will now go to Emily Anderson. Emily Anderson is a professor of bioethics at Loyola University in Chicago. Emily, if you can bring up your screen. And I met Emily a number of years ago when she volunteered to come to Ukraine, to the Ukrainian Catholic University, to lecture on bioethics. And her specialty is the ethics of research. And she's been coming every year ever since. And interesting enough, she has been so enthusiastic about the students she met and what she wants to do in Ukraine that she applied for and obtained a Fogarty grant to admit students from Ukraine into the Loyola program, master's program, and PhD program in ethics. And it's now, I think, in his third year of existence. We had a number of students, one of which will be speaking after Emily, Iryna Stelmakh. And so, Emily, welcome to this forum, and let's hear your musings.
Yeah, well, hello everyone, and thank you for having me, and thank you for listening to me in English. As Vassyl said, I have now for several years had a partnership with Ukrainian Catholic University for bioethics education in Ukraine, and thank you also, Dr. Lonchyna, for describing a little bit about what bioethics is and why it's important to medical education, and that it is perhaps one of the elements that's missing from medical education in Ukraine. As you mentioned, let's try to go through my slide here. I was invited by Father Ihor Boyko and Natalia Zupka from the lecture program in the 2016. They reached out to Loyola University Chicago, as we are a Catholic university in a city with a large
So Emily, are you back on?
I'm back, and I'm going to keep my camera off because I think that should help. But I did lose my connection, and I'm so sorry. I can't do anything about it right now. But all of that is just to say I was very inspired by the Ukrainian people, by the Ukrainian physicians I met, and by the university. And I really wanted to take advantage of this opportunity that's provided by the U.S. National Institutes of Health Fogarty International Center for International Bioethics Training. And so during my third visit, I worked with my colleagues at UKU to develop an application. And it turns out that we received notice of our funding in March of 2020, right at the beginning of the pandemic, when we didn't know how long the pandemic was going to last or how long it would be difficult to travel. Briefly, this is a program that's funded in 5-year blocks. So we are about to finish up our third year of the program. Again, has been happening completely during the pandemic and the war. Our goal is to train 10 to 12 fellows, and to provide comprehensive education for those who are really going to be leaders in bioethics in Ukraine, those who are going to develop educational programs for researchers, for physicians, and for bioethicists, those who are going to lead development of and reform of research ethics review policies and regulatory structures at the national, regional, and institutional levels, those who are going to serve as consultants to individual researchers and institutions whose research raises unique ethical considerations, and those who are going to conduct normative and empirical research on research ethics questions and also broader questions in bioethics. And those are really our goals. The fellowship includes as its core component completion of Loyola's online master's degree in bioethics with core coursework in research ethics. And there also is the opportunity to complete the doctoral program. Also, as part of the fellowship, we have individualized plans for each student, which includes individual research projects and mentoring relationships with UKU and Loyola faculty, as well as monthly online seminars, journal clubs, and English language tutoring. Initially, we had planned twice annual on-site intensive workshops. I was going to go to Ukraine once a year for 2 weeks. Students were going to come to Chicago once a year for 2 weeks. Those were just starting. We were just starting to think about that when the war, when the first day of Russian invasion, and so that has been on hold. And we've really been focusing, I'd say, through the challenges of the pandemic and then the war on the coursework and getting students through that degree and completing their coursework successfully. So we've had a lot of challenges, but I have been, totally inspired by my students' dedication and resilience, and the way they have continued to complete their coursework and be dedicated to their coursework, not just during the war, but maybe in spite of the war, as a way to continue planning for their hopes and dreams. I was on another seminar a few days ago, and someone said, to be Ukrainian is to be planning for the end of the world and also the future at the same time. And I have found that to be very, very true, and something I hold to heart. And I also have to say, I've been very inspired by how my students have gelled as a group, and how they've supported each other and shared information over the last 3 years. And you can see how proud I am as I refer to them as my students. I certainly don't feel that I own them, but I feel so close to them that I want to claim them as mine. Currently, all of our students are physicians, but this is also open to other healthcare providers and other scholars who have an interest and background in bioethics. So we have opportunities both for postdoctoral fellows, who are those who have completed terminal degrees, such as an MD, JD, or PhD, as well as those who have MA degrees in relevant fields, as pre-docs, perhaps philosophy or theology. In order to get into the program, you have to be able to get into Loyola's bioethics program. This includes a fairly high bar for TOEFL or IELTS, English tests, although now we're accepting more like Duolingo and others, as well as some letters of recommendation, writing sample, things like that are standard for applying for master's and doctoral programs. And the program comes with a lot of benefits, tuition coverage, a modest stipend to allow for some release of work, access to campus and resources at UKU, as well as all the library resources at Loyola, and additional funds as needed for books, English tutoring, computer, things like that. I have to say that I've been very pleased with our progress and the caliber of students that we've enrolled, and you'll see what I'm talking about when you hear from Iryna. In August 2020, our first student started. Since then, we have had 7 students start the program, and we have another one that will be starting in January. We also have several applicants under review. Here on this slide, I have a picture from when we all gathered. Iryna hadn't joined us yet. When we gathered in Lviv in October, that is the one time I've been able to to visit Ukraine since the beginning of the pandemic. I have the cities where everyone comes from on the slide, so you can see the great geographic diversity. We also have a lot of diversity in terms of medical specialties. We have Iryna, our obstetrician, pediatrician, pathologist, rheumatologist, primary care physician, and cardiologist. And it's really been great to learn about medicine in Ukraine from these amazing students. As today, I'm thinking a lot about Day of the Defender. I want to remember one of our students who died in May, an oncologist, Dr. Maxim Basarab. He was an oncologist in Dnipro. He had chosen to stay and treat his patients. And at the time of his death, he was becoming very inspired to write about his experiences, both caring for his oncology patients and the ethical challenges that are faced by oncology researchers in Ukraine. And this is just an example of how being in this program had inspired him to start to, really view himself as a scholar in bioethics and become a leader. And his untimely death was really sad for all of us, and a big loss for Ukraine in terms of losing just an amazing doctor and an inspiring leader. And I did want to remember him as I talk about the accomplishments of my other students who are here. In terms of these other accomplishments, one of our students is a member of a committee who's developing national guidelines for conducting research with human tissue samples. One of our students has established and is now going to chair an institutional review board, which is a committee that reviews research at Ukrainian Catholic University to help faculty there meet international standards and be able to publish their work in international journals. Another one of our students who's faculty at Summa State University recently led a successful effort to add required modules on bioethics to MD and PhD education at Summa State University. And of course, you'll all meet one of our more recent admissions, Iryna Stelmakh, who's a resident in obstetrics. I want to thank our advisory committee, of which Dr. Lonchyna is the chair. Without this group, I wouldn't have, I think, found and selected the amazing people that have been part of this program. And if you're interested at all, I'll also drop this in the chat, or you have colleagues, students, people that you mentor, people that you talk to, living in Ukraine, interested in bioethics. Please reach out to us and we can talk to you about our application process and what's required of the program. It is a very rigorous program. Mostly it's conducted online, but it is very much like being in a real live academic program where you have to attend class and keep up with students, keep up with assignments in real time. But I found our students to be up to the challenge of the program. So thank you for letting me share. I'll put my video back on. Thank you for letting me share a lot about this program. It's been really exciting and transformative for me as a bioethics educator, even despite all of the challenges that we've had.
Yeah,
so Yaku.
And thank you, Emily, for all that you're doing. I mean, the fact that you have been such a stalwart supporter of the ethics program in Ukraine, and even to the point of obtaining this grant, which is a quantum leap forward in allowing students to obtain advanced degrees in ethics and then go back to Ukraine and utilize. And you've shown that your students are utilizing their knowledge already in the realm of ethics and research and in ethics and clinical practice. So thank you so much for all that you've done.
My pleasure.
Okay. Victoria? Okay.
Maybe I'll start screen sharing.
Yeah, Iryna, if you would like to start then, talking about your story.
Yeah, I'm ready.
Excellent, thank you.
So yeah, I'm afraid Dr. Lonchyna already mentioned a few things that I'm going to say. Sorry, but
And if I can just interject that, Iryna did not know
And let us invite the
of my talk at all. I never shared that with her, and so this is strictly her observations, and they just happen to correlate. Go ahead.
okay. So yeah, I am a third-year OBGYN resident doctor in Ukraine, and I understand that my Ukrainian study and American study, they are different. These are different degrees and different subjects, but still I was able to compare those experiences, and I have a lot to say. So 15 minutes is not enough for this topic, but I hope I'll mention the most important things. So there are a lot of differences, but I would like to summarize them into 3 bullet points. The first one is the respect towards students. The second one is the desire to professional development. And the third one is the theoretical education versus practical. First of all, I know the universities are different, and I can speak only for my university, which is, by the way, considered one of the best in Ukraine. But I only heard different stories from people from another educational facilities. So that's not my personal experience, but still, I think I can present my thoughts, and they are applicable to all medical universities of Ukraine. So what I mean by the respect towards students, and maybe in case of Ukraine, that's more a lack of respect towards students, unfortunately. This starts from the moment you get accepted, because I would say that in Ukraine, when you enter medical university, there is a type of principle, and I would formulate it as be thankful that you were allowed to study here. I hope I can explain that. I mean, this determines the way the professors and any other staff communicates with students, and that determines your whole medical journey. Medical education in Ukraine is a undergraduate degree, as you may know. So we as a students, we enter medical university when we're 17, 18 years old, while in US, medical degree is a postgraduate degree, and people who go to med schools, they already have certain educational work, life experience, but Ukrainian students, they don't have any of that, and they enter medical universities full of hopes, full of ideas, and what they face, they meet professors who received their professional and personal formation in those Soviet years, and they inherited those old approaches, old teaching styles, and they welcome those students with disrespect, with so-called educational paternalism, and the attitude that students are really inferior to the professors. That's maybe what Professor Lonchyna experienced during his program. So students don't really have right for additional questions, for personal opinion, activity, and this is what I've never experienced in my American study. In US, professors, like, they encourage students to generate fresh ideas, to they are ready to clarify the material, they are ready to answer questions, and they actually want students to have questions. They are ready to share the literature, to consult students, and actually the concept of office hours was very new for me. I didn't know it really existed before I entered my bioethics program, but I really love them because you are invited to, like, visit your professors, and okay, not anytime you want, but actually you're welcomed to talk, to analyze something. But in my case, I was able to, like, email my professors, but still you can receive any support you need. While in Ukraine, this concept does not exist at all. So students in Ukraine are rather seen as competitors or future competitors, but not as colleagues who you can work with and enjoy working with. I can even say that during my Ukrainian classes, physicians really like to, like, catch students on something they don't know. So you can be condemned for not understanding certain information or forgetting certain information. And again, that's what never happens in US, because you're free to clarify things, you're free to ask questions, and nobody blames you for that. And the second point is the desire to professional development. And again, in case of Ukraine, that's more the absence of desire to professional development. In US, students are expected to use the last and the newest literature, to read international guidelines, to be involved in research, to learn languages, and nothing of that is the part of a basic Ukrainian curriculum. And in reality, our professors can praise those old, outdated textbooks and praise all those old approaches. And I'm not absolutely sure why it is like that, but I think that's just because they are familiar to that information and they don't want to develop. As a result, students have no consensus on what they should study, what they should read, and what they should learn. By students, I mean both undergraduate students, like people who are in the university, and postgrad students, residents. And doctors, those who belong to new generation, they sometimes, or the more and more of them, want to know the new information, to implement new methods, use different drugs, to apply, to follow international protocols. But they receive no support and can even be blamed and made fun of, which is what I recently experienced during my residency. But American education, and not only American, is about continuous development and about continuous study. I'm not saying that Ukrainian education is, like, hopelessly bad and completely neglected, but it is like that to a great extent. And unfortunately, a lot of people who are about, like, in their 30s still follow that old style practice. As an example of that uncertainty that still exists in Ukrainian medical education, I'd like to tell you a case from my personal experience. First, I have to clarify that in Ukraine, we still have, as a part of our Soviet heritage, that so-called urgent care and midwifery centers, which are located all around Ukraine in almost all the villages and small towns. And once we had, in a short period of time, 2 different classes. During one of them, the professor mentioned that these centers are like essential for our healthcare, and without them, the whole system is going to collapse. And during the other class, we heard that these centers should be eliminated as soon as possible because they don't let Ukrainian healthcare to progress. I hope everybody understands that that's not possible to have like so different opinions on healthcare, and there should be a type of essential things that everybody would agree on. And talking about the research, it exists in Ukraine, but not in the same form as it exists in US. The government does not provide real facilities and does not encourage doctors to engage into research. By the way, research is very important in US. It's important important in the admission process and later on. But in Ukraine, you can the physician can spend his whole professional life without any research, and that will be completely okay. Overall, there is a lack of clear direction and algorithm for both students and residents of what they should do, what they should learn about the views, ideas, and approaches. They're not sure whom to follow, whom to listen, what to read. And unfortunately, a lot of people don't become great physicians, although they could, but the system works against their development. And there is one thing that I think is related to both points I already mentioned. It is that doctors in Ukraine are really not interested in sharing their knowledge, both with students, residents, and with their colleagues. So they don't see it as a priority, even when they are like teachers or like clinical physicians. So what I saw in my Master of Arts program is that the professors are open. They are so open to sharing the information, to passing their knowledge to their students, no matter who we are. And they enjoy working together, and that cooperation and collaboration is essential for their work, for their practice. And the one thing that I really loved about American educational style is that the evidence of your professionalism is that you can successfully teach others. This does not exist in Ukraine at all, again. So it's actually the opposite. We usually say that those who cannot become great physicians and great clinicians go to like educate others. And the last but not least, there is one thing about Ukrainian and American education, the one difference, which is obvious for maybe any one of you, and I wouldn't say something new, but still Ukrainian education is extremely theoretical, while American education is extremely practical. So, but I think everybody understands that that's impossible to learn practical skills from textbooks, but that's actually the problem for a lot of residents, and that is my personal experience as well, because we do observe much more than we can practice. So again, Professor Lonchyna mentioned great things about those like old reports which took place in US. We need much more hands-on teaching in our curriculum. So that's actually it. And I hope I said something important and maybe something that may be interesting for others. And again, thank you for having me. Thank you for having the opportunity to talk to you today. And yeah, thank you. Slava Ukraini.
Thank you, Iryna. We are so sorry for your sad experience for Ukrainian education. Can I tell, I think, a couple of words? Can you hear me? Yes, I have some troubles with internet connection. We are working at the medical university, a lot of presenters today, and I must tell that we have a great amount of post-Soviet educators, teachers, and we had access to the clinics, and our students are free now to choose their elective courses. And we have excluded all of Russian literature from our teaching materials. And we try to do our education process more better, yes. And we are on the way of the clinic, of the university clinic, and hopefully it would be a day then we will the same level as we will near the same level as an American education. But I must tell that I am teaching the students too, and it is normal way. I am professor too, and we have a lot of teachers that are student centristic, you know, that is not it is not problem to ask the question or to write the message in the night or to then ask something. So it is so sad that you have meet some kind of teachers in Ukraine. So we are sorry. Thank you for your experience, and we will try to do the best for our students.
Maybe I can say one more thing. Well, I actually forgot to say that, okay, not all the professors I met were like that. And, but you know, analyzing that period after a few years after graduation, like, you know, there's still a general feeling that follows you after those years. And unfortunately, that my general thoughts are more negative than positive. But yes, I'm not that hopeless. And a lot of Ukrainian physicians and professors, university professors, are not that bad. And I met both like old and young people who I respect. But unfortunately, that's the thing. Things are like that.
So it's raises the question and the point that we must do the better, the things that can violate all these troubles that are present in our teaching process, and we will do the best for our students. It's a point for the
that's exactly right.
For teachers. So thank you. And
for improvement, and we have to all strive towards that. That we improve the situation of the educational system and process. So absolutely, that's the theme that we need to go forward with, improvement. Great. So now it gives great pleasure to introduce Rebekah Bihun, a Ukrainian, who is at the Mayo Clinic School of Medicine. She's a third-year medical student. Interesting enough, she last year started a seminar for her fellow medical students about the Ukrainian health system and about health reform. She had, for instance, as one of her speakers, Iryna Stelmakh and others talking about the situation in Ukraine. And this year she's focusing more on medical education. And so I wanted to have her come and talk on this forum about what Ukrainian American students are doing overseas, that is in the United States, to foster information about the Ukrainian healthcare system, about Ukrainian education amongst the peers, and also what her thoughts might be on ways of improving the system. So Rebekah, thank you for joining us.
Thank you so much. Thank you for the invitation, and I'm excited to meet you all and be able to talk with you today. So let me share my screen. And does everyone see my slides?
Yes.
Yes.
All right. So, Dobro dnia, as Dr. Lonchyna said, my name is Rebekah Bihun. I am a medical student at the Mayo Clinic School of Medicine in Minnesota. And I'm excited to talk with you today about a project that I've been involved with. I am in my third year of medical school here. So when I entered medical school a couple of years ago, I really was thinking about ways to support Ukraine, to support healthcare and medical reform in Ukraine. And so the course that I'm going to talk about and this project I've been involved with is kind of one way that I tried to solve that that question for myself. And throughout this project, I really wanted to focus on the theme of dialogue. I believe, I was actually a teacher before entering medical school, and I believe that dialogue is a really important part of education, and in particular, education that changes people and has positive results throughout students' lives. So I titled this presentation, Supporting Reform Through International Dialogue, because that really does reflect kind of my values and the themes of the work that I've been doing. So I'll tell you a little bit more about how this course came to be. So when I entered medical school, I learned about an opportunity that the Mayo Clinic Medical School had where students could actually be involved in creating coursework. And the courses are 1 week long, and they're for first year students for the most part, and then some second year students as well. There are a certain number of courses that students need to participate in, and these can be clinical courses, they can be experiences in healthcare, or they can be more lecture-based. And there are many courses to choose from, but as part of that, students can also create a new opportunity if they have a particular interest. So with my interest in Ukraine and in healthcare in Ukraine, I really wanted to create an opportunity to share my interest with other students and to help American students know more about Ukraine and learn in dialogue, as I mentioned. So some of my goals with this project were engaging Americans in dialogue with Ukrainians. I think I really wanted to create a platform for American medical students to be able to meet Ukrainians, to talk about Ukraine with Ukrainians and have that dialogue. We in medical school don't have too many opportunities to talk internationally with people, and especially in the pandemic, our opportunities for international conversation were more limited. And so this course was an effort to address that. I also wanted to understand medical reform in Ukraine, both as a personal interest, but also I think learning from the process of medical reform in Ukraine. Ukraine has been through these really sweeping reforms in the last several years. And in the United States, we talk about healthcare reform as well. And it's an ongoing process. And so I think learning about medical reform in Ukraine, I really wanted to highlight this both for my learning about Ukraine and other students learning about Ukraine, but also for then us bringing those lessons back to the US and thinking about how we can improve our healthcare system here as well. And finally, my other goal was really promoting collaboration and future partnerships. So one of the wonderful things about coordinating a course and a lecture series is the connections that you make, the people that you meet, and those conversations I really want to kind of develop and foster into partnerships in the future as well. And as a small example of that, I'll talk about this more, but some of my students from last year have expressed interest in continuing to participate this year and kind of revisit some of the conversations that we've had. And so that's really what I wanted to promote and what I think I've been able to do so far. So a little bit more information about the course and what we talk about. So here are some of the topics that we covered. I ran the course in 2021, and then I'm planning it again in a few weeks for 2022. So the course is taking place over 1 week, as I mentioned, and it meets over Zoom. We actually have students, the Mayo Clinic has medical schools in Minnesota and Arizona, so we have several campuses and locations where our students are joining from. And then also the great part about Zoom, as we're experiencing now, is that we can connect with people in several countries and everyone can join the conversation from where they are. So the course is hosted on Zoom, and it is about 20 hours over the course of the week. Last year, kind of the themes for each day I outlined here, we focused quite a lot on healthcare reform. Monday, kind of introducing students to Ukraine, Ukraine's history and culture and the context for healthcare reform. And then throughout the week, learning more about the process of medical reform, leading medical reform, and the healthcare system in Ukraine. And so on the bottom here, you can see some of the speakers who've participated in the past and will be returning. Dr. Lonchyna mentioned Dr. Iryna Stelmakh has been involved in this. Pavlo Kovtoniuk was one of her deputy ministers of health. And then we've had faculty from the Ukrainian Catholic University and private practice doctors in Lviv. And so this year, I am hoping to cover a lot of the same information from last year, but adding a little bit to it as well. I do want to have a day kind of focusing on how the war has impacted healthcare and healthcare reform, and also talking a little bit more about medical education. So looking forward to welcoming some of today's speakers as well, and introducing in more topics to our American medical students to kind of help them see the whole picture and to see more of the picture of medical care in Ukraine. So here were some of the results from last year. And I surveyed the students who participated in the course. And what I really want to highlight for this slide is that one of my goals with this project and with education in general is translating learning into action. So while our time in the course is limited, I really want to encourage students, and I hope that this course can be an inspiration to students to be involved in continued projects, both in Ukraine and in the United States. So I asked students about their attitudes toward healthcare reform in the United States. And as you can see, our students were more interested in healthcare reform and in that process in the United States as well after participating in this course. Students felt more confident about their ability to make an impact during their medical career. And that's something too that I think is so important as a student, hearing that we can make a difference, and that, hearing from leaders and people who have been involved in healthcare reform in Ukraine, and seeing some of the possibilities for ourselves in the future both with international work and here at home. And then also, one of my goals with this course was to increase American students' knowledge about Ukraine and their desire to go to Ukraine in the future. And as you can see, we had really positive response from students who'd be interested in traveling to Ukraine in the future, where, I'm hoping in the future to coordinate trips when it's feasible to travel with a group, and looking forward to opportunities there. So these were some of the results from last year. I'm looking forward to this year's course session, seeing how students respond. And overall, I'm interested in the long term in thinking about how to carry forward this work. I want to continue educating American students and involving Ukrainians and Americans in this dialogue about healthcare reform. And I'm excited to see what happens over the long term and how we can continue translating learning to action. So I have put my email on this slide, and I would welcome anyone who's here, who's listening, to reach out to me, bihun.rebekah@mayo.edu, to continue this conversation. Part of the conversations I have around this course and the dialogues that we have are kind of brainstorming ideas for the future. So I want to be involved in those conversations, and I want to talk with you as well about your thoughts. So those are, that's kind of what I had prepared, and I'm happy to answer questions either about the course or other ideas that you have, and continue the discussion.
So Rebekah, when you had Iryna Stelmakh last year, did she talk about perhaps what she thought was the future of healthcare reform in Ukraine, especially since she's no longer in government? I mean, she knows how difficult it is to work in government. She certainly did a lot to change some things with much resistance, and the changes she placed were very good, but there certainly is room for more. Did she give any, did she look in the crystal ball and tell you what she thinks will happen, in the next?
Yeah, so one of the things that she talked about, and her work is ongoing as well, and she has kind of shifted her focus from the kind of the government side of things more toward cultural change. And so that's a lot of what she talked about, is a lot of next steps involve the culture of healthcare changing, and that, again, that happens kind of through dialogue, through education, through people talking to each other. And I think there's, she didn't mention specifically in terms of policies going forward what she thought was needed, but she talked a lot about the culture of change, and she's written a book to try to, speak to that as well. So those were, those were some of her observations, and we can, I think we can keep talking about that too, but I hope that answers your question.
Oh, yeah. And then, that the survey was very, very interesting. I wonder if you thought about maybe having a pre-course survey to see how many people, I mean, obviously, if they're attending your course, they're interested in healthcare reform, but perhaps you'd like to also gauge if your course has changed the level of interest. So it might be interesting to, as you start the course, to do a pre-course survey to see how, what people's attitudes are towards in their interest in healthcare reform, et cetera.
Yeah, absolutely. Last year I had kind of thrown that survey together in the middle of the course, realizing that I wanted to have some information from students at the end. So this year I have a little more time to prepare. And yeah.
Excellent. Yeah.
So
any other questions or comments?
it looks like no. So we would like to thank to all speakers for the important points that were raised during the section. And I would like to thank to my co-chair, Professor Vassyl Lonchyna. And we are going to the closing ceremony.
But before I do that, sorry, Victoria, but Iryna Vashchuk Di Scipio has arrived, and she is in charge of Revive Soldiers Ukraine, and she's kind enough to give us a presentation. So we will do that at this moment before we close the meeting. So Iryna, the floor
Hi.
is your screen, please.
Yes, so my name is Iryna Di Scipio, and I'm a head of Revived Soldiers Ukraine. We opened up this charity in 2015 as of a response to a crisis war in Ukraine, in the east of Ukraine. And the main focus of Revived Soldiers Ukraine was to help severely wounded Ukrainian soldiers with medical care in the United States. And going through the years, we ended up opening a rehabilitation center for paralyzed soldiers and civilians in Irpin, right outside of Kiev. And as of today, we're working on a second location of Next Step Ukraine in Lviv. It will be more advanced. It will be more medical. We also help wounded Ukrainian soldiers, as well as hospitals and medical facilities and military units. We're purchasing ambulances for them. We're purchasing tactical medicine. We're purchasing bulletproof vests, helmets, radio station, and so on. Our list is pretty large. If I can join this meeting with a little presentation, I can show more in like pictures and numbers, so it will be more understandable. But the main focus is still for us is to treat the most complicated cases in the United States and to cover as many medical bills in Ukraine, as we know that Ukrainian medical system are not perfect up to the end as US does. VA hospitals are taking care of their wounded soldiers, and we try to do as well, but not to full extent. So that's when we come in as a nonprofit and covering like metal plates, heads, arms, medical medication, whatever it takes, prosthetics, whatever. So I would like to see how can I add my presentation. Pane Vassyl,
Share screen.
can you help me out?
First of all, is your presentation on your screen?
Okay, I see share screen. All right.
At the bottom is share screen.
All right, just open system preferences. It's all right. So I cannot do that. So I guess I will have to explain. I will open up.
Is your presentation open on your laptop?
Yes, it is.
Okay. So and then on your Zoom screen is at the bottom says share screen.
Mm-hmm.
When you hit that, let's see. Let's try it again.
Yes, share.
Share screen.
Open system preferences is taking me to somewhere. I don't know. Didn't take me anywhere really. Meanwhile, so I'm as of right now, we're working on getting to United States about 5 wounded soldiers for complicated prosthetic legs. Mostly, as of right now, we have in the United States, we have 6 wounded soldiers that obviously have complicated injuries. It's more 3 of them are special forces that we can really show faces or anything, but we're helping to the full extent. 2 of them in Massachusetts General Hospital and 1 in Chicago at the University of Illinois Hospital. And we brought 1 very young guy to US first to Orlando, Florida. He lost arm and a leg in the battlefield in Mariupol. He's a Marine, and right now he's in the United States. We are giving him a bionic arm. So probably in a couple of weeks it will be ready, and we can actually share over Facebook or social media or on a website. And his picture actually in the presentation, if I will be able to open up. Until February 24th, Revived Soldiers Ukraine was only focusing on wounded soldiers. Since then, we're helping everybody. As I mentioned, our rehabilitation center is in Irpin, and many of you know that Irpin was occupied by Russians We lost our rehab for a couple months, but fortunately we survived as a rehabilitation center, but the housing for soldiers was destroyed. So at this moment, we're replacing everything with our own efforts as a charity, and we lost several rehabilitation specialists. They went to the war to help Ukraine and wounded soldiers in the front line. So we got shortened in our staff, but we're working to the full extent. Before we were treating a lot of Ukrainian Irpin civilians, Bucha Irpin civilians who suffer injuries during the evacuation from war zone area to Kiev, and right now we mostly work with the soldiers. We have a lineup of people, and it's crazy times because any day we're expecting Russia to again occupy the territories. We know that their troops are lined up on the Belarusian border. It's only 3 hours away from Irpin. In that response, we decided to open a second location in Lviv. We are working closely with the Brooks Rehabilitation Center here in Jacksonville, Florida. One of our wounded soldiers was rehabilitating here. So we're taking their model and we work with their medical reps to put everything possible to Lviv and provide the best rehabilitation for Ukrainians in Ukraine. We taught our staff in the United States. We brought them to Brooks for training with the rehabilitation equipment as much as to work with the patients, learn how to work with the patients, learn American ways, how to work with the patients, and now we're implementing some in Irpin. We will continue with the Brooks Rehabilitation Center. In the end of this month, we have one paralyzed soldier arriving to Brooks rehab for intensive course rehabilitation for 2 months. And us, Revived Soldiers Ukraine, together with Umana, will be covering his medical expenses. And we will continue to learn how to work with such patients. The guy is paralyzed waist down and he lost his leg above the knee. So it's kind of multiple injuries that we will be dealing here in the United States with this particular soldier. So can we show our performances on the screen?
Still working on and trying to get your report. I will.
Yes, so we're kind of proud that we could supply Ukraine with at this moment 36 ambulances. We provide them to military hospitals and as well as the paramedics on the front line. So 32 already arrived and 6 on the way to come to Kiev. That's where we distribute among units. We're very pleased to inform that we supply Ukraine with 95 cars overall. Although we lost one, our own Next Step Ukraine car, our rehabilitation guys, when they were evacuating Irpin, left on the bridge and Russians just destroyed the car. So they destroyed one, we supplied 95. Overall, aid to Ukraine provided through Revived Soldiers Ukraine as of today is close to $7 million. We try to utilize this money as much as possible. We're checking every prices. Our team is working on finding the best deals out there and buy everything needed. We purchased 21 ultrasound machines. This is portable machines, could be used in the ambulances as well as urgent care rooms or like emergency rooms and just regular hospitals. We supplied Ukraine with 4 portable X-ray machines that we distribute among army hospitals, and 1 is in Lviv. We still need to deliver to, I think it's 5 hospitals that located in one. I forgot the name of the particular place where we have to put this X-ray. So everything, it took a lot of effort of our team here in the United States as well as our team in Ukraine. And we're trying to provide the best for the as minimal cost as possible. And we're always looking for doctors here in the United States to help us negotiate with the hospitals and medical facilities to place our wounded soldiers, possibly for no cost, as we have in Boston right now at Mass General. 2 of those guys costing the hospital about $1.5 million US dollars, and it doesn't cost us Revive Soldiers Ukraine anything outside of placing soldiers, bringing to United States and taking care of their daily basis. This is very costly, and it requires a lot of time, and our team is doing our best to help our wounded servicemen to return them back to the front line. As of right now, 6 soldiers fighting on our prosthetic legs that we gifted them here in Orlando, Florida. And we're very proud of it. And these people are very educated and trained, and we cannot lose them, toward the fact that they're missing legs. So that's our work, and I'm open to any questions if anybody has any. And still the presentation didn't go, sorry.
It's going to come.
It's very bright presentation, has pictures, and it's very interesting.
I just put it on my laptop. I'm going to share my screen. If I could just, I'm not quite that quick, but I will share with you, with everybody.
Yeah, so our goal right now to help out at least 10 soldiers above the knees amputation with bionic legs, provide them with bionic legs. We just negotiated the price, about $40,000 per soldier, and we try to raise it in our earliest convenience to help out our wounded servicemen. You can go down.
Okay, is it there or not yet?
Yeah, that's, we can see it. We can see it.
Partially, yes.
Okay, but it's.
So these two men that you see on the front screen, one of them on the right, he's actually Georgian. He fights for Ukraine since 2015. He's lost his leg in 2018, and we brought in 19 him to United States. We gifted him a prosthetic leg, very doable for the fight. So, and he's a sniper. He came back and he actually defended Irpin. And he was ready for fixing his prosthetics. So we brought him back just last month, and we replaced his leg. The second young man on the left, you see he's a Marine that I mentioned in the past, Roman Horodensky. He lost arm and a leg in the battlefield in Mariupol in April of this year, and he really wants to go back to fight, so we're gifting him a bionic arm right now in Philadelphia. It costs us $35,000, and his walking leg and a running leg. He got both here in Orlando, so that's done. And so if you're gonna go down, you can see our work. So there's a few ambulances you see. This is the first ambulances we brought from Denmark in March 2022. We were the first one who brought ambulances to Ukraine, actually, first responders to the crisis in Ukraine. Those ambulances, actually, half of them were used to evacuate civilians from Irpin and Bucha area. They were like driving like I don't know, taxi cars back and forth and helping people to get out of the danger zone. So as I mentioned, we brought 32 already, and 6 to come. So on the left, you see Kyiv Army Hospital. We placed, this is the X-ray machine that I have mentioned. It's come from Australia, actually, but we bought it in Washington State. So there's 4 units we bought, and our partners also added 7. So we could manage to bring together with our partners 11 units to Ukraine and distribute them among bigger hospitals who treating our soldiers, which include Dnipro, Poltava, Odessa, Kharkiv, Kiev, and Lviv. So on the right, you see our work on supplying first aid kits for paramedics, as well as supplying blood cloth, Celox, I don't know if you're familiar with that, tourniquets and other things. So we did supply quite a bit. I think we spent by now about $80,000 on just resupplying the first aid kits. We're still on the introduction. So that's me. Next to several of ambulances, we brought a lot from Italy. Those ones particularly come from Italy. So as you see, the numbers for August is much bigger now, $5.9 million. We start to purchase rehabilitation equipment for Next Step Ukraine in Lviv. We got already half of it. I think we spent $400,000 so far, and we're looking for another $400,000 at least to be one of the best rehabilitation center in neuro recovery. Outpatient in neuro recovery. So equipment for field hospitals, as I mentioned, is X-rays and portable ultrasound machines. We bought negative pressure devices, and we're resupplying them. As you know, that negative pressure devices that treats large wounds is very important right now as of Ukraine getting back its land, and we're going forward to free Ukrainian territories, and we're losing a lot of soldiers, as well as we're getting a lot of injured. And Odessa Army Hospital is just screaming to resupply the Genadine. We purchased Genadine devices and we placed to the Army hospitals. So we keep resupplying. Just a couple of weeks ago, we purchased 50,000 worth of supplies for those Genadine devices. So ambulances and vehicle, one of the vehicle, actually very interesting situation. We got a fire truck for air base in the west of Ukraine. I cannot mention their names or how they're called. So what they do, because of the large attacks on all over Ukraine by air, our air base is moving every day. So our pilots are moving runway every 2 days. And what they needed is the lifting trucks that can lift the, like this, I don't know, the runway pieces. And also a fire truck to, in case the fire starts, because the runway is so short. So we supply them with those equipment. So it's very kind of unique projects that we talk a little bit about, but they do a lot for Ukraine and for winning this unfair war. And of course, help Ukrainian wounded soldiers. If you're gonna go down, you can see a few images of actually the people we're helping. So right here we have Volodymyr Luchko. He is Alpha Forces. We can show his face anywhere outside of this presentation to very few people. He got wounded near city Izum, and he's if we would not bring him to United States, this particular case went to went to Boston. It's a Massachusetts General Hospital, and Massachusetts General Hospital overtook the whole cost for him, which is up to $1 million. And we saved his leg. Otherwise, probably most likely due to that severe infection he got from shrapnel, he would probably most likely deform his leg or as we saw in many cases, got amputated. So he's going to recovery. He's 6 months here in the United States already, and rehabilitating, and hopefully we will return him back soon to Ukraine.
What
There's
is a dollar figure that you have at the bottom?
yes, that's the number. Is only for a travel cost and placement in Boston. It's up to month of August, as I mentioned. It's more right now, but we're only covering food, room and board, and really travel, visas, travel. So this we go with that. We spend our money on all negotiation with the hospitals, but the numbers are actually the actual numbers to treat this particular case up to $1 million. So, and our work in the Ukraine to cover individual cases for wounded Ukrainian soldiers in Ukraine, as I mentioned, Ukrainian government not supplying all the hospitals with the necessary material, necessary medication. So this is very small list. Right now, we're gonna go full blown on helping wounded soldiers that keep requesting help. So that's what it's usually comes either from a doctors, from volunteers, or from a soldiers itself. We'll also help to treat cancer soldiers. So we're covering medication for cancer, prosthetics that could be done in Ukraine. Not every soldier can receive a governmental prosthetic from prosthetics, legs or arms from government due to their own voluntary efforts, which is voluntary platoons in this case. So that's when we came across, and we are trying to feed this gaps. So there's just a few numbers on help in Ukraine. So this is our rehabilitation center in Irpin, Next Step Ukraine. The operational cost for us is mostly like salaries because we own the building. I mean, we own the space. It's not a big space, it's outpatient facility, but having this small space, we do quite a bit. 3 rehabilitation specialists work throughout the year with the long-term rehab for neuro injury, and we could accept up to 55 wounded soldiers, that was last year, and about 30 civilians. We do both. So about 80 to 90 people is being treated a year at our rehab. Is not a large number, but we have to understand it's a long-term rehab. And when soldiers arriving, we're giving them room and board, we give them transportation, we give them medicine, whatever they required. We bring them to doctor's visit and everything. And we actually taking care of their rehabilitation with us. I would say it's one of the best rehabilitation approaches. We got one of the best rehabilitation staff. Also, Irpin has quite a bit of rehabilitation equipment that US hospitals using for years, and we were practically the first one to bring it into Ukraine. We taught our rehabilitation staff to work on those devices. So those couple names we have mentioned, what we're treating in and so this is the aid to the hospital. We talk about sonoscanner. It's ultrasound machines that we distribute among many hospitals as well as our partners. So we helped our partners as well. Whatever we find, we would give them, hey, we found this. And I think together with our partners, we could supply over 40 ultrasound machines throughout Ukrainian hospitals within this period of time of 6 months. And this is the supplies for Genodyne in the boxes to treat large wounds. So those are the numbers we have spent. And now we're going to the military stuff. That's the fire truck I have mentioned that went to the west of Ukraine. We have a lot of requests from military units. So that's kind of our temporary project that Revive Soldiers Ukraine is doing, because we're helping our military on the front line. We don't have to treat them afterwards. We're saving their lives on the front line, on the first response. So SAPR engineering teams, we do supply engineers to demine cities. My brother is actually an engineer. He was demining Irpin and Bucha, and now fields around the area that was, I would say, like, that Russian left us with some mines. So vehicles, drones, we purchased medical drones. That's a huge machine, $30,000 a piece. We're supplying them with the find and rescue teams to help find people, find injured. So we did a lot. There's you see the numbers are pretty large, and they're gonna go down, I'm sure, because we're slowly moving to helping wounded soldiers. So our numbers to help wounded soldiers will be much larger going forward. And so future projects, there's several devices we put just as an example here. 2 medical devices that we're looking to purchase right now. It's a Diego and Amadeo. The company locates, I believe it's Switzerland. Ukraine has very few of these devices so far, and we would like to put them in Lviv as well as in Irpin. As you see, $200,000, only 2 devices, and we need more than that. So we work closely with our donors and other charities in the United States to raise these funds and help Ukraine rehabilitate our people. This is at least what we can do as volunteers, and this is our, I would say, that's we can't just sit and do nothing. We have to do stuff, and we do stuff, and hopefully this war will be end soon. And unfortunately, the casualties of the war we will be dealing for many years to come, and our team is ready to work and resupply, supply Ukraine with the most advanced equipment and Ukrainian rehabilitation and the hospitals. So thank you very much for listening to me. And if you know anybody who is in the United States, any doctors or any facilities who can help provide soldiers to Ukraine to bring more soldiers, we have so many requests. I can't even start talking about that, but I'm really asking you for help. If you can, please get in touch with me.
Thank you so much, Iryna. You've done a wonderful job. For so many years, you've put your entire energy into raising funds and bringing all these soldiers over and helping them. And now with the war intensifying, you've done so much more to help all around. Thank you so much for what you're doing. I have 2 questions for you. You mentioned in one of your slides that for several months in Irpin, you were not active. Is that because did the Russian soldiers occupy your hospital or your next step facility?
They occupied the whole city. For the most part, the area where our hospital is, our rehabilitation center is located, was a kind of neutral territory. So Russian didn't come to that territory. I don't know how Russians wanted to take out Kiev. They couldn't even take my Irpin entirely. So that territory was kind of, our snipers, as I mentioned, Sandra was one of them in platoon Karpatska Sich, and their snipers, they couldn't like get to that area. So we kind of we literally survived, maybe because of Father Mykola Buryatnik came from Chicago and blessed the rehab center last summer when we opened up. But prior to that, we were right next to Irpin Army Hospital. We were renting a space there, and that building is completely burned down and destroyed, including the Irpin Army hospitals where Russian soldiers were actually staying. They left total mess in that whole area. We were survivors. One of our apartments located right next to Irpin Army hospitals, where we placed soldiers, and we lost that apartment for now. The tank shot the 6th floor. We were on the 7th, so we kind of burned together, and we're slowly rebuilding. And hopefully, we will be able to offer this space to place wounded soldiers soon, hopefully.
Now, your next step clinic in Lviv, you're working on that. we've heard that. So the V is talking about building the biggest rehabilitation hospital in Ukraine. Of course, that's a lot of talk right now. I'm sure he's going to come
Yes.
with it, but what is your opinion of that? I mean, it sounds like
It's good. It's good because it can provide more help to people. And as I mentioned, with the casualties of war, we will be dealing for a long, long time. We're talking about if a person paralyzed, right? We're talking waist down. The person needs rehabilitation throughout their entire life in order to, in order to escape the complication from a secondary complications with the organs and stuff. So we have to provide this rehab throughout the whole life. So our soldiers keep coming back to us. They're kind of rotating. The orthopedic injuries is less complicated, and it's kind of month or 2 month period of time rehab, and person went on its own and went to serve for Ukraine or home. When it comes to neuro injuries, it's very, very long and complicated process. That's why we overtook this particular way of work, because it's hard, and I'm looking for, tough stuff. I like challenges, and I really, happy about the results, what we give to people who can stand up, before they couldn't, or who can talk before they couldn't talk, or they can use their arm before, they couldn't, due to the injury, like head injury mostly. It's a rewarding process. It's long and rewarding process. And in Lviv, as I mentioned, we want to do like the best. Like I said, like whatever I walk in the Brooks rehab, I like, whatever you have, guys, we're taking the best what you have, and they suggesting us what we should get and what it's okay, it doesn't really work for us. And some devices costing $200,000, some $250,000, some as little as $5,000. So we're all over the board with our purchases. But right now we're doing remodel. We purchased a building again. I mean, the space for us, we're twice as big in European space now, so we could place more equipment in. And we're doing remodel right now. We're getting a medical license, and about 3 months from now, we're also purchasing this equipment, and it has to be made for us. It's not just available, it has to be made. So this is the time we're gonna hopefully get together toward the winter, and we're gonna start working maybe January, February.
excellent. It seems to me that in talking about healthcare reform, that Ukraine as a government ought to set up a system of veterans hospitals like they have in the United States that would take care of all of these problems, not just rehabilitation, but other problems that soldiers have following their service. But
everything is very important. Unfortunately, it's in a stage, I don't know what people were doing for 8.5 years of a war in Ukraine, why they still don't have anything established. But time is very important, especially in neuro injuries, and the fact that we're already having treating it, and hopefully in 3 months we will get more people to receive help. That's very, very important, because we're smaller. We're not talking big like mayor of Lviv. While they're gonna build, while they're gonna get everything, while they're gonna trade stuff, while they're gonna get all this, we're already gonna work. So we're not talking big numbers, big spaces. We talk about stuff that we can afford as a nonprofit. We are not a huge nonprofit, and we are volunteer-based nonprofit. So I feel very I feel very happy of what work we have done and what we're doing already.
excellent. Thank you. You've done tremendous work, and you continue to do tremendous work. Thank you.
Thank you, guys.
That'll conclude our conference as far as this session goes. Victoria, shall we conclude the Congress?
Yes, I think yes.
Okay, well, thank you to all the speakers. Thank you to all the participants. and continue fighting for a free Ukraine, continue with your medical education, continue with rehabilitation, and we'll see you next year for Smart Line 7. Hopefully we can all come to Lviv and participate on site in Lviv.
You're welcome in Lviv.
Слава Україні.
Героям слава.
Окей.
Героям слава.
Всього доброго. Дякую.